But I think also sometimes patients don't want to get screenings because they don't understand the importance, or sometimes they might think, I'm worried about what the result might show and what, their life is going to be further. Welcome back to my channel. If you haven't seen any of my videos before, my name is Natalie. I am a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. I also take a look at personal statements and resumes, so if that's something that you need done, please take a look at the description box down below, and there's a whole process telling you how that can be done. So for this particular video, I really wanted to talk about the importance of preventative screenings. It's very, very important that all of us as providers have like a little file stored in the back of our minds to make sure that we're asking our patients that they're getting their screenings at their particular age for particular conditions. We really want to make sure that our patients are not getting any further complications of any conditions because there's a lack of screening, or we want to make sure that we're getting whatever it is at the earliest stage. So I'm going to talk about a very nice resource that is really good to have, as an app or on your computer to look at different screenings and what ages they should be started at, and that's something that you can refer to, as well as different screening measures that I personally used in my primary care clinical, and kind of the more common ones that you might be using on a more regular basis. Of course, the list that I'm going to give you is not exhaustive at all, but it's just something to give you an idea of something that you're going to be seeing very often, so that you can have it stored in the back of your head, so every time you see a patient of a certain age, you can automatically say, did you get this screening? Or if not, you can at least look at their chart. But it's very important, whether you're asking the patient or you're looking at the chart, to make sure that it got done, and also to make sure what the results were. So let's go ahead and talk about it. So the resource that I was discussing before is called USPSTF, or US Preventative Services Task Force. It's a very, very great and reliable resource, basically, that tells us when people should be screened at what age. I think it's something that you should have, again, on your phone as an app or on your computer, because I think it's something that you need to refer to if you don't have it, memorized. And also, they're continuously changing and updating regulations and when people should getting screenings and all of that. So that's something that you want to keep making sure that you're updated with. But I would definitely have that somewhere, again, on your phone or your computer to refer to. So the first screen that I want to talk about is something that I think everybody knows, is getting your mammogram, to make sure that we're seeing if there's any breast cancer in each of our patients. And according to the USPSTF, breast cancer screening should be started at age 50. So of course, when you have a patient that is a woman coming in and she's 50 or she's about to turn 50, that's a really great topic to educate on, saying, you're 50 or you're about to be 50, we're going to have to start the screening process of breast cancer. And of course, there's definitely, people that are not going to meet the regular criteria. If they have a family history of breast cancer, they're probably going to get screened earlier. But let's just say a patient that doesn't have any of these risk factors. So that's when you would start screening, because we want to make sure that our patients do not have any breast cancer, and if they do, that we're catching it at the earliest stage. But it's very, very important that if your patient doesn't want to get screened, that you educate them on the importance of screening and the importance of catching any diagnosis or any cancer early, and to help prevent further complications. Because I don't want you guys to just say, oh, well, they didn't want to do it. No, educate them. Of course, keep educating them. And if they still don't want to do it, again, sometimes patients just don't want to get screenings. But I think also sometimes patients don't want to get screenings because they don't understand the importance, or sometimes they might think, I'm worried about what the result might show and what, their life is going to be further. So just make sure that you're very understanding and compassionate and empathetic with them, because sometimes screenings are, a little bit scary for people. But as far as mammograms to prevent breast cancer, to check for breast cancer, that starts at age 50. So of course, like I said before, USPSTF is constantly changing updates. Well, not constantly, but they are consistently changing and updating regulations of when people should get screened. So everything that I say now is based off of what is right now. Of course, in the future, things can change, and things are changing right now for a couple of different screenings, but until they are officially on the website and officially in practice, I'm just going to say what is already on the website. And I'll put the website down below, because I think is something that you need to have in your resource toolbox anyway. So the second screening is called a DEXA screening, and basically that is to check for osteoporosis in your patients. And usually it's more for women, and they start that at age 65 plus. And we really want to make sure that we are checking that because there's an increased risk for fracture, increased risk for fracture, increased risk for falls, increased risk of going to the hospital and having other complications in the hospital. So we're trying to avoid that altogether because we want to make sure if our patients have osteoporosis, they're having the correct medication that they need, and they're doing the, weight-bearing exercises and everything that they need to do to help, prevent anything worse, or if they have osteopenia, just to make sure that they don't get to the osteoporosis status. So that is something that we check. That is something that happens very, very often. And if you're having a patient that is meeting the high-risk criteria for a DEXA scan and they're 65, that's something that you also want to educate. Remember, education is a huge, huge part of our work because we want to make sure that our patients understand what they're doing, why they're doing it, and the importance of it. So that's the second preventative screening that I did pretty often, or wrote out pretty often. So the next preventative measure is getting a colonoscopy, and that's to help check for colorectal cancer. So for this one, if you check on the website, there's a couple different criteria of when to start screening. So if you go ahead and look on it, I recommend you do, because there's one part that says that they should start at 45, and then there's another section that says that they should start at 50 for different reasons. So I think that's something that when you're trying to figure out if you should start screening at a certain age, go ahead and look at USPSTF and see what their reasonings are to start at those different ages and what your patient kind of fits in their criteria. But that's something that you really want to check for colon cancer. Again, if you have a history of colon cancer or colorectal cancer in your family, you're probably going to get screened earlier than that time frame. But again, this is just assuming that nobody has any high risk symptoms or high risk family members or anything like that. But that's what you would do for that. We want to make sure that everything is fine, and that's when you start screening for colorectal cancer. So another really important screening is checking for cervical cancer, and that's when us ladies get pap smears. I know it's super, super fun and super lovely, but it's something very important that we need to do. And according to the USPSTF, if you are aged 21 to 29, they recommend getting a pap smear every 3 years with just cytology only. Cervical cytology only. Then when you are 30 years of age to 65 years of age, you can either every 3 years get a pap smear with just cervical cytology alone, or you can go every 5 years and get cervical cytology along with HPV testing. So you see that there's different regulations depending on your age and depending on what type of testing that you want to do, if you're high risk or not. So that's another thing where it's kind of hard to remember, and actually they are changing the guidelines for pap screening, for pap smears. That is in the works, and it's in the process of updating. So this is what it is for right now, but soon it's going to change. So it's just really important to know when the ages of these screenings to start, because we don't want to get delayed. We don't want our patients to get delayed, because it can turn out to be it could be a tragic thing if we wait a little bit too long. I've had a couple people that I've seen that, especially with cervical cancer, that they were delayed in getting a pap smear, and unfortunately they do have cervical cancer and it's not at a good stage. So it's really sad to see that some people can have certain diagnoses and conditions because of a lack of preventative screening, which is something that I know can be a nuisance, but it really is there to help prevent any further complication or to help catch things early. So really really educate your patients. And I don't think there's anything wrong, and please correct me if you think otherwise, but if you have a patient that maybe doesn't want to do preventative screenings, and you have kind of like a story about a patient who didn't do preventative screenings and turned out to have like a very serious condition, I don't think there's anything wrong, obviously not saying any patient identifiers, but I don't think there's anything wrong with letting that patient know that doesn't want to do the screenings of that story, and just say, hey, I really don't want this to happen to you, to, please let's get this preventative screening done, especially if they don't want to do it. I don't think there's anything wrong with that. But just to let you know the importance of it, catch it early, and to help prevent any further complications. So another part of screenings that I want to talk to you guys about, not necessarily USPSTF, common screens like mammograms, colonoscopies, and stuff like that, but I want you to make sure that depending on whatever patient's conditions that they have, that you're getting the proper screenings done for that patient, because for each condition, there could be further complications, and of course, you want to be able to treat the condition without your patient having any further complications. So just to give you an example, any diabetic patient, you want to make sure that they're going to see either the optometrist or ophthalmologist yearly. Some people go twice a year, just to make sure that there's no retinopathy, because of course, diabetes can cause blindness, so that's something that you want to make sure that they're doing. And also they want to see the podiatrist probably yearly, because sometimes they have neuropathy, and if they need to take care of their feet, because sometimes they can't feel if there's anything different, or they can't see underneath. So that's something that you want to make sure that they are doing too. So it's not just screenings of getting your mammogram done, getting your colonoscopy done, but making sure that whatever condition that your patient has, that they're getting their annual screenings, that they're getting their annual checkups, that they're doing what they need to do, seeing their specialist to help get their, keep their condition on track. So that's just very important as well, that I thought I would just throw out there. And of course, that's not an exhaustive list. Every patient has many different conditions, and you want to make sure that they are doing what they need to do to take care for their condition in the best way. So thank you guys so much for watching. I hope that it's helped. Please go take a look at USPSTF and just kind of search different screenings and see, what they have to say about that. It's a very, very, very great resource, and I'm sure that if you're going to work in primary care, you are going to use it all of the time. It's really, really good, and it's very straightforward. It's easy to read, and it definitely helps provide some evidence-based practice of why you're doing X and Y treatment. If you guys have any questions, please leave a comment down below, or you can go ahead and email me. I hope you guys have a wonderful morning, afternoon, night, whatever time it may be, and remember to always, always believe in yourself. All right, you guys have a great one. Bye.